I would like to have you both permission to use this testimonial for educational purpose and on internet. Do you have your permission?
Yes, you do.
No. Tell me about your symptoms before our surgery.
It was terrible. I had terrible pain in the right going down my leg. I would sometime buckle because I had trouble walking.
Okay.
It was going over into my groin. Yeah, the pain was just unbearable.
Yeah, and you saw some doctors and they throw some diagnoses out there. Tell me about it.
Oh, well, most of them was bulging disc. No, you don't have bulging disc. Yes, you do have. I had a nerve test done. They said it was neuropathy. And the next time I went in, they said, no, it's not neuropathy.
Okay. How did we figure out what it was?
I came to see you.
No, but what did we do? You remember?
No, I don't. That was back.
Do you remember those injections?
Oh, yes. I had injections. My first one lasted about 3 weeks. The second one lasted about 10 days.
But that's how we figured out the problem is coming from that location.
Yes.
And then we did the surgery a little more than a year ago.
Yes.
Correct?
Right.
Did you stay in the hospital? How long?
Oh, I was out the same day.
Yes, you were out same day.
Yeah, I don't know how long. I was really in counting surgery and
Phew.
recovery.
The
Because
surgery-
my blood pressure was kind of screwy,
Yeah.
so I was in a little bit longer.
You were in and out of surgery faster than I could get out of the waiting room.
Yeah.
So, can you say that one more time?
She was in and out of surgery faster than I was getting out of the waiting room.
Yeah. So the surgery actually takes less than 20 minutes. So you have been going for 2 years with this problem. In 20 minutes, we fixed that. We put 3 screws through one hole in your sacroiliac joint, and that's the joint that woman used to give birth to a baby, opening up a little the pelvis for the baby to pass
Need
through.
more of that.
No, well, hopefully all of us, we don't need that, right? And when did you notice things are different?
Oh, it took some time because I ended up having blood clots. I ended up having a blood disorder.
After the surgery?
After surgery, yes,
Okay.
yes. It took I had gone to 2 or 3 doctors and was complaining, and they said everything was fine. I came to you. You did a D-dimer test,
The dimer test, yes.
and before I got back to the infirmary, you called and said get to the emergency room
Yeah,
immediately.
so unfortunately, even a small surgery, even 20-minute surgery is not risk-free. And that is one of the things I need everybody know. Even though this surgery is very efficient, still a surgery, and especially we ask you not to use that leg.
Well,
And
I do have a blood disorder going on now too, so
As well.
I'm sure that contributed to it completely.
But we figured out, as soon as we had the information, we figured out that it might be related to a blood clotting, and then you got help with that, right?
Yes.
And then they put you on a blood thinner and so on?
I was on blood thinners for maybe 3 months, I think it was.
So even small surgery is not risk-free?
No,
But when did you notice that pain was gone?
it was getting better, I would say. By the time I was done with blood thinners and going to see doctors in Fargo for my blood and this and that, it was getting better. I was so concentrated on the blood clots and stuff at
And
that
you-
time.
She was having so much trouble with the knee at the
Yeah.
time. I don't think
Oh.
she's been bothered with her hip.
Another
anymore.
problem.
Yeah.
Well, how are you now?
I feel good.
The walking is okay?
Yes.
That pain you had before the surgery, is it gone
Oh
now?
gosh, yes.
Yes. Overall, even though this wasn't straightforward, because most of my patients don't have blood clot after the surgery. Overall, happy that you did the surgery?
Yes.
Okay. Could you have lived like that, like you were before the surgery?
No.
No?
No. No. No, I wouldn't want to live like that.
Okay. Well, what other question do you have, or what other comment do you have for me? What do you want people in similar situation know?
Well, it sure helped me, and I'm a 75-year-old overweight lady, so yeah, I mean, I hope you have to go through it and you have just as much luck as I did without the blood clots.
Without the blood clot. Now, obviously, the goal of the surgery is enabling you to go through your daily life and be able to walk, take care of your daily chores, and just have I would say, excessive activities,
Right.
because that's not really good for any of us, with or without surgery, but it is to enable you to do your daily life.
Right, I've had a better quality of life after the surgery.
Well, that was the goal. Thank you so much.
Thank
I
you.
appreciate that. Well,